Venkatesh, Professor of Forensic Medicine, working with SDM College of Medical Sciences and Hospital, Dharwad. I am briefly going to discuss regarding dead body disposal of Covid-19. As we all know, the coronavirus infection is also called as Covid-19 has spread to the entire world, causing Covid-19 pandemic. Thousands of people are infected every day. Hundreds of deaths are occurring worldwide. Disposal of dead has taken a new turn due to highly contagious nature of the virus and different religious cultural sentiments worldwide. If you look at death, it may be COVID positive or COVID negative. If it is a COVID negative death, the disposal of the dead will take a routine procedure. Just hand over the body to the relatives, they will dispose of as per their religious sentiments. If it is COVID positive, the death may be either natural or unnatural. If it is a natural COVID-19 positive death, then you have to inform the district health authorities or government health authorities for the safe disposal of the dead body. They will come and collect it in a safe manner and dispose it off in the form of incineration or burial. If it is an unnatural death, which is also called as medico-legal death, as per the law of the land, it is mandatory to take it for medico-legal autopsy. The medico-legal autopsy has to be conducted taking all the precautions with the PPE, and at the end of the autopsy, the body has to be again handed over to the district health authorities or government health authorities. They will dispose of in the safe way in the form of incineration or burial. There are certain advantages and disadvantages in both incineration and burial. Most of the Western world, American and European continent is following the burial. Not the regular burial, but the deep burial, as per their religious sentiments. The procedure followed in suspected death. Suspected means it is neither positive nor negative. There are certain deaths where the patient will die with the symptoms of COVID-19 at home or in the hospital. In both the cases, it's your duty to inform the government or district health authorities regarding the death. They will come and collect the swab and send it for testing. Till the test results come, it's your duty to keep the body in a cold chamber. Once the results are ready, if it is positive, again the disposal procedure follows the same, safe disposal by the government authorities. If it is negative, then hand over to the relatives and they will dispose of as per their religious sentiments. Regarding disposal procedure, the same standard precautions to be followed by the healthcare worker while handling dead bodies, which are taken by any healthcare professional in his OPD or ward or isolation area. They are nothing but hand hygiene, use of personal protective equipment, that is PPE, safe handling of the sharp instruments, disinfect the bag housing the dead body, disinfect the instruments and devices used on the patient, disinfect the linen, clean and disinfect the environmental surfaces where the body was stored. Removal of the body from the isolation area. The health worker attending to the dead body should perform hand hygiene and wear proper PPE before touching the body. Once he is ready with these things, he can remove the tubes, drains, catheters on the dead body without creating aerosol or leakage of the body fluids because they may be contagious in nature. Any punctures, holes, wounds resulting from the removal of the catheters, drains, tubes should be disinfected with the 1% sodium hypochlorite solution and dressed with the impermeable bandage to prevent the leakage of the body fluids. Apply caution while handling sharp instruments like intravenous cannula or any other sharp devices. They should be disposed in a sharps container. Plug the oral cavity, ear canal and nasal orifices with the help of cotton bud to prevent the leakage of the body fluids, because the secretions from the nose and oral cavity are highly contagious in nature. If the family members wish to view the body at the time of removal from the isolation area, they may be permitted with the standard precaution of safe distance at a distance of 8 to 10 feet without touching the body. Place the dead body in a leak-proof plastic bag. The exterior of bag can be disinfected with the help of 1% sodium hypochlorite solution. The body bag can be wrapped in a mortuary sheet or a white sheet provided by the family members. The body will be either handed over to the government or district health authorities or stored in a morgue till the government authorities arrive. All the used or soiled linen should be put in a biohazard bag, and outer surface of the bag should be again disinfected. Used equipments should be autoclaved or decontaminated with the disinfectant solution in accordance with the standard infection prevention control protocol. All the medical waste must be handled and disposed of in accordance with the biomedical waste management rules. The health staff who handle the body will remove their PPE and perform hand hygiene at the end of isolation of the dead body. At the end, he or she can provide counseling to the family members with respect to their sentiments. How to clean or disinfect the isolation area. All the surface of the isolation area, whether it is a floor, bed, a railing, a window, side tables, IV tubes, etc., should be wiped with the 1% sodium hypochlorite solution. The best way is allow the sodium hypochlorite solution in contact with the surface for a minimum period of 30 minutes and allow it to air dry. Procedure of handling of dead body in a mortuary. Again, the mortuary staff handling COVID-19 dead body should observe same standard precautions as discussed previously. Dead body should be stored in a cold chamber maintained at approximately 4 degrees Celsius or below. The mortuary must be kept clean. The environmental surfaces, instruments, and transport trolleys should be properly disinfected. After removing the dead body, the cold chamber, its doors, handles, and floor should be cleaned with the 1% sodium hypochlorite solution. Embalming should be avoided or discouraged as much as possible. What are the precautions taken during transportation of the dead body to the burial or cremation ground? The body secured in a body bag, exterior of which is decontaminated, pose no additional risk to the staff transporting the dead body. The person handling the body may follow same standard precautions like wearing surgical mask, gloves, and performing hand hygiene. The vehicle, after the transfer of the dead body to the cremation area, will be decontaminated with a 1% sodium hypochlorite solution on either side, inner side as well as outer side of the vehicle. The precautions taken at the place of crematorium or burial ground. The crematorium or burial ground staff should be sensitized that COVID-19 does not pose any additional risk if the staff practice standard precautions of hand hygiene, use of mask and gloves, etc. Viewing of the dead body by unzipping the face end of the body bag by the staff using standard precautions may be permitted for the relatives to see the body for a last time. The religious rituals such as reading from religious scripts, offering prayers, sprinkling holy water, and any other last rites that does not require touching the dead body can be permitted from a safe distance. Procedures like bathing the dead body, kissing, hugging, or touching of the dead body should not be permitted. The funeral or the burial staff and family members should perform hand hygiene after the cremation or burial is complete. The ash does not pose any risk and can be collected to perform the last rites on the next day or the further days. Large gathering at the crematorium or burial ground should be avoided as a social distancing measure. It is possible that close family contacts or members may be symptomatic or shedding the virus. These are the standards, precautions, or guidelines followed by healthcare workers or mortuary people or the funeral staff while handling the dead body at various levels, right from the isolation area to the morgue, in the mortuary, in the transportation, and at the burial or crematorium. For further details, you can also visit the website Ministry of Health and Family Welfare, Government of India, which has issued a manual on guidelines of dead body management. There are certain states which have come up with the guidelines to handle a dead body, but most of the states are still in the process of formulating the guidelines. So they will be ready in a short time and will be released. And the respective state members has to follow their respective state guidelines issued by the government of that particular state. Thank you.